Okay, so in this video we will discuss the blood supply to your cerebellum and the brainstem. Again, the brainstem is has three parts: midbrain, pons, and medulla. So in this picture, in this structure, you see two vertebral arteries, and they are coming from subclavian artery from the heart. So they are coming up. So let's say this is right vertebral artery. This is left vertebral artery. So they come up, they merge together at where there's a junction between medulla and pons, pontomedullary junction. They merge together and form one artery called basilar artery. Okay, this is a basilar artery, one artery. So two vertebral arteries merge together at pontomedullary junction and form basilar artery. Okay, now what we see is that there are two branches coming from vertebral branch artery. You see small branches here. These branches will supply blood to the posterior inferior. So this is the inferior area. Okay, so this is posterior inferior cerebellar artery. Okay, so this is pica, posterior inferior cerebellar artery. Okay, coming from vertebral artery, both sides. Now as we go up, what we see, two arteries, small arteries coming from, again, vertebral arteries, and going down. Now these two arteries are going down. We call it anterior spinal artery. It supplies blood to the anterior surface of medulla. This is medulla, and supplies the anterior surface of medulla, and it goes down, supply blood to the spinal cord. Okay, so anterior spinal artery. Okay, now as we go up, right at the junction where two vertebral arteries are meeting together, there is another artery coming out of at the junction, and that's the anterior inferior cerebellar artery. So that is also supplying blood to the cerebellum. So this was posterior, this is anterior, so it'll be supplying blood to the anterior portion of the cerebellum. So we call it AICA. This was pica and this is AICA, AICA. So this is supplying blood here to the anterior portion. Also, this is also supplying blood to the inferior part of the pons. Okay, a little bit inferior part of the pons. So pica, AICA, and as we go up, basilar artery. Okay, this is a basilar artery where you see these branches. These are pontine arteries supplying blood to the pontine or pons. Okay, pontine arteries. And as we go further up, you see this first artery right here, this lower one, which I'm moving. This is the superior cerebellar artery. This artery supplies blood to the superior part of the cerebellum. Okay, so superior cerebellar artery is right here and supplies blood to the superior part of the cerebellum, and it also supplies blood some part of the midbrain. Okay, so it's also supplying blood to the some part of the midbrain. So we covered how medulla is getting a little bit blood, anterior medulla is getting blood from anterior spinal artery, and pica is also supplying blood to the lateral part of the medulla. Okay, this is medulla. So pica is supplying blood to the posterior inferior view of cerebellum and a little bit lateral side of the medulla. As you go to the basilar artery, at the junction, you see AICA. AICA is supplying blood to the inferior part of the pons. Okay, inferior part of the pons, and going to the anterior part of the cerebellum. Now the basilar artery is not directly supplying blood to the cerebellum. However, it supplies blood to the pons, anterior and lateral aspect of the pons. Very important structure, very important artery. So as we discussed before, what are the function of pons? So if there is any occlusion, you should know that pons is getting majority of the blood from basilar artery, and a little bit inferior part of the pons is getting from AICA. Okay, as we go up, we see superior cerebellar artery. Again, it supplies blood to the cerebellum. So cerebellum. And then as we go up, this artery, we will not discuss right now, because this is going to cerebrum. Okay, so two different terminology again, cerebellum and cerebrum. So this is going to cerebrum. This is posterior cerebral artery, but I'm not gonna go into detail. So we're just focusing on our four arteries here. So this is first is spica, this is your ica, this is your pontine, the branches, this is your basilar, and this is your superior cerebellar artery.